Hi,
Hi.
Dana. Thank you for meeting me today.
Sure. Hi.
How are you doing today?
Good.
Good. First, a little bit about myself. I'm Colleen. I'm a personal trainer, and I'm looking forward to working with you. So, what brings you here today?
Well, I would like to get into better, strengthening shape. I run, and sometimes I have pain in my hips after I run, and sometimes I have some pain in the shoulder when I overuse it. And so
Okay.
I'd like to be stronger to help prevent the pain and discomfort so I can continue to run more often and keep up my pace.
Oh, excellent. So, in terms of your running, how many times a week do you run?
I try to do 3 times a week.
Okay, try 3 times a
Try.
week. So, what happens?
Well, in the summer with the kids home, it just
Mhm.
kind of dropped off, and then back to school, I've been so busy, and I haven't gotten back to it. And then also because I think I'm running quicker and more intensely, I'm having more pain, and so something that I could do every other day is now. Sometimes I need a 2-day break in between, and so then it's like 3 times one week and 2 times the next week.
Okay. So that break, that extended break, is that because of hip pain or?
Yeah, because of pain. But I'd like to get back to every other day, 3 times a week, instead of having a 2-day break.
Okay, so hip pain might be limiting you. And so you had said with the kids in school, do you think now that increases your likelihood of running now that you have a little more time? Okay. Kids in school.
Definitely more flexibility for time. You know.
So all of your kids are in school full time?
Yes, now. Yeah.
Okay. And you talked about shoulder pain. So any, why? So what happened to cause you shoulder pain?
In the first place,
oh, this goes back a bit. Okay, tell me please.
my youngest used to launch himself at me from the change table, and then I remember it started to click, and now it doesn't click. It just wouldn't. I was on the mouse too much yesterday, so now it's really, really tight. I'm always very tight on this side.
Okay, so that's a right shoulder. And you said it's your youngest, so how old is he now?
7.
So you've been dealing with shoulder pain for 7 years?
Yeah.
About?
Okay. It's getting better, because I've done some exercising for it, but it's not, right now it really hurts. I did way too much computer work yesterday, so.
Okay. We'll come back to that computer work stuff. So with your shoulder pain and your hip pain, have you seen a professional, a chiropractor? Do you get massage?
I do both, but the massage is not nearly as much as I should. It's usually once every 6 months.
Okay.
And the chiropractor, I'll see if I feel that, if I feel like there's really a bone out of place. And I don't really feel like there's a bone out of place right now. But, if I go see him, he'll do that. And then he will work on, loosening up my hips or, active, what's it called when they kind of...
Active release therapy.
Yes.
Okay.
He will do some of that.
Okay. And after you have these treatments, do you find that they help?
Yeah.
Okay.
For a time. Yeah.
They're helpful for a time. Excellent. So going back to your running 3 times a week, and in terms of intensity, easy, moderate, challenging.
Well, challenging for me.
Okay, so meaning do you find that you're breathing hard? Are you getting out of breath?
I'm somewhat out of breath.
Okay.
I think my breathing and my heart rate has improved a lot since I started, so not as out of breath as if I, you know what I mean? Yeah.
So, a moderate intensity.
Yeah, I would say moderate.
So, how long are you running for?
5 kilometers.
5 kilometers. Good for you. 3 times a week? 2 to 3 times a week?
Yes.
5 kilometers. And are you doing any strength training?
Not really right now. I have done some in the past, but I've kind of fallen away from that. I'd like to get back into it.
Okay. So ideally, you're wanting to run 3 times a week, and for incorporating some strength training, what would work best for you?
Probably twice a week. That's what you're asking me.
Okay, yeah, twice a week. So I guess 3 runs twice a week. That's 5 days. That's all the days your kids are in school. That's convenient. All right. looking at your running and your strength, what kind of goals do you have? So in a month, so this is mid to end September, so thinking by the end of October, what kind of goal would you have?
Well, a goal would be to get back to running 3 times instead of just sometimes 2 times.
Okay.
And to continue to increase my speed a little bit.
Okay. So, I mean, goal setting works well if they can be specific, but I know right now it's a little bit challenging to think of something super specific, so we could do 3 times a week running for that. And strength goals, I guess, would you say it's to get back to a regular routine?
For strength goals?
Yes.
To my strength goals would be to make myself stronger for the running and to,
What about, like, maybe deal with the
and my shoulder.
Okay.
Yeah.
So,
Like upper back strength and
upper back. Okay, that's... Okay, and so let's think for 4 to 6 months, so January, February. So you've achieved running 3 times a week in a month. You're stronger with your strength training. What can you think of, or can you think of anything to set for maybe a little bit of a longer term goal? Maybe let's go Christmas. Let's think 3 months. End of the year Christmas.
Not really sure. I don't really want to run farther than 5 kilometers right now. Like just continue, because I did a race last spring, and I would like to beat that time.
Ooh, okay.
Which I think I should be able to, because I am running faster than that already.
What was the distance of your race? Sorry.
It was a 5 kilometer.
Oh, excellent. 5K time. That's a good goal, and being able to do that by Christmas, that's a reasonable amount of time.
Also, with my running, I need some hill training. I would like hill training. Because there was a lot of hills on that race, and it kind of killed me.
All right. Nobody usually asks for hill training. I like that. Awesome. So, in terms of other activities, is there anything that you enjoy doing besides running? Like, do you have your kids? Do you like to walk with the kids, play at the playground with them, or maybe do you swim?
Yeah, I like to take the kids to the pool, and I did an aqua-size class, and that was fun. But, I don't know, in the winter I don't really like to swim so much. It's like, what, wet hair, minus 30? No.
Okay, well, saying you like aqua-size, that's a fun thing to incorporate as an additional activity. So,
good strengthening. Well, because when I took it, I really felt it in my hips.
That hips in a good way?
Yeah, well, it was like, whoa, that was a lot harder than I thought.
Good. Okay, so going back to kind of a bit of health things, by your PAR-Q, there are a few medical issues that you did note that would have to be, a consideration just based on any medication you're on. They'd have to look to make sure cardiovascular activity is safe and appropriate for your medication.
Okay.
Last one, your doctor ever said you should only do medically supervised physical activity? He said no. So then he or she would be on board with you being able to work with me then.
Yeah, for sure.
Perfect. That is very good to know. So medically cleared for activity. So we talked about your current activity. We talked about goal setting, what you would like to do within a week, medical clearance. What kind of questions do you have for me? Or what kind of concerns do you have?
I think for a workout, I want everything, I don't know, like, to be done in a timely manner. Does that make sense?
No, that makes sense.
Because time, I think, is always a big factor. It makes things difficult to get done because, even with the running, because I roll out and I stretch, then I run, then I roll out and stretch, and it takes like an hour and a half, and that's a big chunk of my day. And that's partly why I want to get faster too, because the faster I am, then a little bit less time, right? And so with like weight training or strength training, I want to get the most bang for my buck. And some advice of exercises to do or a program like the intensity or how many reps, how many sets, whatever, would be. And that's why I would like to see a trainer, because I don't know that stuff. So.
Okay. I will just kind of say something about one thing you mentioned. You roll and stretch. That's awesome. Did you look that up on your own to decide to do that, or how did you know about rolling and stretching?
Well, I have a friend who runs, and she told me some of the stuff, and I did have a trainer for a time before, and I would talk about my hip pain, and there was a time where I wasn't having any leg pain anymore when my intensity of my run was less. I kind of like, oh, this is great. I always feel good after, and then now it's, starting to get, and maybe what I'm doing, the rolling, the stretching, isn't quite enough anymore. Like maybe I need deeper stretches or different strength training. Like maybe it's a different group of muscles. I'm not sure. I need guidance.
Okay. So working with me, I would definitely, the next time we would meet would be in the gym, and I would do an assessment.
Okay.
I would watch you walk. I would have you do a bit of movement so I can see how your shoulder issue is compensating, or what kind of issues it's causing, and any kind of imbalances your hip might be contributing to.
Okay.
You worked with a trainer. Did you have a positive impression working with that person?
Yeah. No, she was great.
Oh, that's very good to hear. So a good impression. Well, Dana, I don't have any more questions for you.
Okay.
Do you have any questions for me?
Not right now.
Okay. Well, I will give you my cell phone number and email, so
Great.
you can contact me at any time. So I look forward to seeing you in the gym.
I will do that. Thank you
so
much.
Have a great day.
Okay, thank you.